Okay. Okay, so if you are a 35-year-old female with palpitation, abdominal pain, nausea, vomiting, headache.
Palpitation, nausea, vomiting, headache.
Mhm. What's your diagnosis?
Palpitation, maybe like a hypothyroid.
Yeah, it could
I
be.
don't
It
know.
could be.
It
Or
can
it
be
could be
also
pheochromocytoma.
pheochromocytoma. Yeah.
Yeah. So if you have increased TSH with normal T4, what's your diagnosis?
If you have a increase,
TSH with normal T4, T3. What is best next step?
normal T4, T3, what is the next step? I think that's not enough information, but
So this whenever you see high TSH with normal T4, T3, that's called subclinical hypothyroidism. So you gotta
okay.
order anti-thyroid peroxidase antibody. If that positive, you start them with levothyroxine, even if they don't have any symptoms.
hmm
Okay. So if you are a 35-year-old male with weight loss, weakness, your potassium is 5.5 and sodium is 130 and plus hypoglycemia. So what should you do next?
Um, the ACTH.
Yeah, concentropine stimulation test. Good job. Yeah.
hmm
What are the contraindication for combined hormonal contraceptive?
So, age greater than 35, with smoking, um, liver disease, stroke, MI, history of stroke, MI, TIA, all those things. Um, what else? Mm, mm, I think those are the ones that are, yeah, liver disease, stroke, MI, TIA, age greater than 35 with smoking. What
Yeah,
else?
stage 2 hypertension, more than
Right,
160,
yeah.
venous thromboemboli, stroke, breast cancer, major surgery with a prolonged immobilization, less than 3 weeks postpartum, migraine
hmm
with aura. So those are is important, very important. Okay, now good one. So if you have the your glucose is 156, okay,
hmm
and you desire to lose weight, so what anti-diabetic that can let you decrease glucose and lose weight at the same time?
That is the exenatide. What do you call it? Gliptin?
What's the mechanism of that?
But I know you can lose weight with that.
Yeah, it's a GLP-1 agonist, right?
hmm
Yeah, so this you can lose weight with a good job, yeah. And low hypoglycemia risk when used alone or
Right.
with metformin. How about
hmm
sitagliptin?
Sitagliptin.
Yeah, this one for renal insufficiency you use that.
Okay.
Okay, DDP4 inhibitor. How about pioglitazone?
Pioglitazone is it not one of the thiazolidine? Yeah.
Yeah, it's used in renal failure too. That can be used in case like renal failure. You can't use metformin and stuff, so you can go with the other stuff.
hmm hmm
What are the main side effects of sulfonylurea
Hypoglycemia.
and weight gain too?
Yes, weight gain.
So metformin and DDP4 inhibitor sitagliptin, they are weight neutral. So this you gotta keep in mind. Okay.
Okay.
Now, if you're a 60-year-old man who have an increased phosphate and an increased parathyroid hormone, so what's causing that?
Increase phosphate and increase BTH.
Yeah.
Okay. Is it like a chronic kidney disease? I don't know.
Excellent. Yeah, it is a renal chronic kidney disease. I like how you think. Good job. Yeah, hats off.
I was like, you are really making it really tough, huh? Okay.
But you're really good at picking it up. Good job. So now, if you are a 17-year-old female with a potassium of 2.3, HCO3 of 40, bicarbonate is 40, urine chloride is 15. So what's causing this lapse?
Urine chloride is 15. So, you know what we said yesterday, when the urine chloride is less than 20, things like vomiting,
Yeah, good job.
yeah,
Yeah,
and,
vomiting, diuretic
and G-tube
abuse.
aspirations, things
Yeah,
like that, yeah.
yeah, good job.
Mm.
So, so if someone having weight gain and constipation and delayed deep tendon reflexes, when
Mm-hmm.
you do the labs, you have increased free T3, T4, and normal TSH.
Increase free T4.
Yeah, T3, T4, and normal TSH. So what's going on here?
So, subclinical again, hypothyroidism,
No, this is resistance, general resistance to thyroid hormone.
general resistance to
Mm,
thyroid hormone.
yeah,
Mm.
yeah, because you know why?
Mm-mm.
Yeah, like because the labs TS T3 T4 is high, and you're supposed to have hyperthyroid symptoms, but instead you're having hypothyroid symptoms. So
Mm-hmm.
that's the difference. Okay.
Mm.
Okay. Now glucose of 1000 and potassium of 5.9. What's your diagnosis?
HHS.
Good job, smart. Total body potassium depletion.
Mm-hmm.
So now, if you are a 46-year-old male with albumin of 2.2,
With what?
albumin of 2.2,
Albumin. Okay.
yeah, and total serum calcium of 7.5.
Calcium 7.5. Okay.
Now, what's best next step, or what's causing this lapse abnormality? Why do you have,
Okay.
why do you have low calcium?
Sometimes they say to what do you call it? Recheck the calcium. And then it might be due to albumin. Albumin is low, so you have to correct it, but you have to repeat first.
So, what is the equation for corrected calcium?
Man, you are okay. All right. Is okay. So the measured total calcium, right? Plus 0.8, then into the abnormal albumin 4.0 minus the serum albumin, right?
Yeah, so 0.84 minus the serum albumin. Yeah, you're right.
Mm-hmm.
Good job, yeah. So now, how do you treat Graves' disease?
Or Graves' disease, how do you treat it? So you're gonna do, first of all, give them a beta blocker to control the heart rate, and then you're gonna do the what do you call it? The thyroxine. What is this one called? What are those medications? Betimazole or PTU,
Yeah, the
right?
thiamide, yeah.
Yeah. Mm-hmm.
What else?
And I guess it actually also depends. You can do either medical, or you can do iodine ablation, or you can do what do you call it? I think you can do. Can you do surgery in this one? I don't know.
Yeah, yeah, of course. Yeah, you can
Okay.
do surgery.
So depending on the patient's choice, and also if patient is pregnant, you can do the iodine ablation.
Okay, nice, nice. Now, this is a good case. If you are a 35-year-old male
Mm-hmm.
with bilateral gynecomastia, your
Mm-hmm.
testosterone is 270 and estradiol is 115. So normal testosterone is 3 to 10, but your testosterone is 270
Normal is what?
is 3 to 10.
3 to 10, just 10,
Yeah,
or
but
310.
no, no, 3 to just 10.
Okay.
And but your testosterone is 270 and
Mm-hmm.
normal estradiol is 20 to 60, but yours is 115. So
Okay.
what's your
Hold on. Let me tell my husband that I will call him back. Okay.
okay? So what's your diagnosis? Yeah.
Bilateral gynecomastia, testosterone is 270, estrogen is 115.
Yep.
Okay. Is estrogen normal or high?
It's very high. Normal is 20 to 60.
Mm-hmm.
Yeah.
Mm. This one, is it like a tumor or something? I don't know.
Yeah. What type of tumor?
So what type of tumor will give you very high testosterone? I'm thinking maybe prolactinoma. I don't know. No, prolactinoma will give you decreased testosterone, right? And libido.
Right. Right.
I don't know which tumor this one is.
Leiding cell tumor.
Oh, yes, 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 lady. Yes, you're right. Okay.
So if you are a 36-year-old woman with
Mm-hmm.
palpitation, throbbing headache, diaphoresis,
Mm-hmm.
your blood pressure is 230 and your calcium is 11. Your parathyroid hormone is elevated.
Okay, hold on.
What's your diagnosis?
Um, your calcium is what?
11.9
Mm-hmm.
and you have palpitation, throbbing
And you
headache
said it parathyroid is what?
is high.
It's also elevated. Yeah, it looks like men too.
Wow, that's smart.
Yeah, I was thinking about, okay, this patient has pheochromocytoma and then also parathyroid, issues. So the MTP men 2A, right? Yeah.
Good job, yeah. And type 2B is they have mucosal neuroma and marfanoid habitus.
Right.
So there's a difference. How about type 1?
Type 1 is the three Ps,
Hmm?
like the what the parathyroid, pancreatic, and pituitary, the three Ps.
Okay.
Did you get it?
Yeah, yeah.
Okay.
Yeah, I know what you're talking about. Parathyroid pancreatic. Yeah, there's no FEO here.
Mm-hmm.
Okay.
Fear is only 2A and 2B.
Yeah.
So you have the three Ps, then you have the
Yeah.
MPP, yeah, MPP, MP, something.
Yeah, you're right, yeah.
Medullary thyroid cancer is 2A and 2B.
Yeah, yeah, right. So now, if you are a 56-year-old woman with diabetes,
Mm-hmm.
watery stool, and erythematous plaques with central clearing on the skin.
Erythematous plaque
Yeah,
and central with central clearing.
yeah.
Okay, I'm thinking. Okay, diabetes and skin rash. Glucanoma. Is that the one?
Good job. Yeah.
Oh,
So how do you
okay.
diagnose that?
Oh, glucanoma. You have to check the. What do you check again? You check glucagon, right? Level.
Yeah, more than 500. That's it.
Hmm.
What else?
And then if it's more than 500, I think you do now like an imaging to go look for it. You
Yeah.
know where it is. Yeah, and then resect.
Good job. Yeah. Good job. Now your potassium is 5.4 and glucose is
Hmm.
470. What's your diagnosis?
Also, this will be DKA type 1.
Good job. Good job. Now, if you are a 40-year-old man with norepinephrine is elevated and thyroid nodule, so
No epinephrine.
yeah, norepinephrine is increased and there is a thyroid nodule. Okay, so what else would you expect in this patient?
Okay, so I think it's also almost like the same thing that we did men 2A. So with men 2A, you have the pheochromocytoma, you have the thyroid nodule, which might be medullary thyroid cancer. And then you have the check also the, what do you call it? Um, parathyroid. Is that is that it? I don't know.
Yeah,
Hello?
yeah, yeah, you're right.
Why are you pausing?
No, I'm just grasping everything. Yeah, yeah, you're right. It's a mucosal neuroma. That's most likely associated, or it could be parathyroid hyperplasia in
Hmm.
10 to 20% of the cases. Yeah, good job, smart. So now, if you are a 55-year-old male with with renin activity is undetectable and your potassium is 3.1, so what's your
Hmm.
diagnosis?
Renin activity undetectable.
Mm,
That would be Cohn's hyperaldosteronism.
good job, good job. Wow, look at you.
I want to crush this exam.
You will, trust me, you will.
I want to crush it. I want to stay in Dallas.
Yeah, that's
So
cool.
I want to see if I.
Yeah, you can't stay. Yeah, if you crash this exam, you definitely stay wherever you want. Yeah, I admire that. Yeah,
I want to stay with my boys.
yeah, I really admire that. Yeah, that's good. So now, if you are a 56-year-old male
Hmm.
who's present with a 2 month of fatigue and poor appetite and weight loss,
Fatigue,
yeah,
poor appetite.
and weight loss, your
Hmm.
parathyroid hormone level is low, but the 125 hydroxyvitamin D is 14, and the
One what? One alpha hydroxy.
yeah, vitamin D is 14, so it's on the lower side, and calcium is elevated. So this is I'll give you in 3 words, okay? Weight loss, calcium of 14.8,
Hmm.
parathyroid hormone is 5, very low. What's the
Hmm.
diagnosis?
Hmm. I'm thinking because of the weight loss and the high calcium, maybe this is a cancer. Might be due to, malignancy, right? And the most probable malignancy might be the small cell.
Yeah,
I don't know. That's what I'm
yeah, yeah,
thinking.
hypercalcemia of malignancy. So
Mhm.
what could cause hypercalcemia with
Hypercalcemia.
yeah, with hypothyroidism? What other causes?
Hypercalcemia with hypothyroidism.
Yeah, increased calcium and low PTH. What other causes cause that?
Oh, low PTH. Okay.
Yeah.
So increased calcium, low PTH. Mm. things like what do you call it? Immobilization, right?
Yeah, what else?
Oh man, that list, I think that's the only one that I remember. So I know okay, vitamin D deficiency, mobilization. Yeah, I'm not very
Vitamin toxicity, vitamin D toxicity,
okay.
malignancy,
Okay,
sarcoidosis, hydrochlorothiazide, thiophyllin,
okay. Do you mind?
thyrotoxicosis.
Can you repeat the whole thing again?
Yeah, malignancy,
Mm-hmm.
vitamin D and A
Mm-hmm.
toxicity,
Okay.
sarcoidosis,
Sarcoidosis, okay.
granulomatous disease, hydrochlorothiazide, thiophyllin. Big one, milk alkali syndrome cause that.
Okay.
Immobilization,
Or make alkali, yeah.
adrenal insufficiency,
Um,
acromegaly,
that's a lot.
pheochromocytoma, yeah, you name
Oh
it.
wow.
How about the one that cause high calcium, okay, with high
High
PT?
cal
Yeah, high calcium and high PTH, which one?
that's the primary parathyroid. It can be the primary parathyroidism, okay? It can be the FHH, familial hypocalcemia.
What else?
Hmm, those are the two big ones that I remember.
Add to that,
Oh, hold on. I think also the tertiary parathyroidism is also that, right?
right, and
Yeah,
also lithium and teriparatide.
lithium, okay.
Yeah,
And oh, okay, the medication, teriparathyroid.
yeah.
Okay, okay, okay. Mm.
So if you have hyperglycemia with hypertension and weight gain,
Increased calcium?
y- hyperglycemia
Oh, hyperglycemia. Okay, increased glucose. Okay.
with hypertension and weight gain, what is diagnosed?
Hypertension and weight gain. So increased hyperglycemia, hypertension, and weight gain. Hmm. Increased glucose, hypertension, and weight gain. Oh, maybe is it Cushing's?
Smart,
Oh, okay.
good job.
Cushing's. Cushing's.
If you have a
Jonathan, is that
TS,
you, Jonathan?
huh?
Okay. I'm sorry, my son is talking to me. Sorry. Go ahead.
Okay, so if your TSH is 6, T,
TSH is
yeah, T,
TSH is 6. Okay.
yeah, T3 is 222. What's your
T3
diagnosis?
223. So TSH is it low or high? I think is
It's, yeah, it's high.
on the high side. And
It's,
T3 is also high.
yeah, and they have
Oh,
increased deep tendon reflexes.
increased deep tendon reflexes. Hmm. Um, something that has to do with hyperthyroid.
No, it's a
What is it?
thyroid. It's a thyroid secreting pituitary adenoma.
Thyroid. Say it again.
It's a pituitary adenoma that secretes TSH.
Oh, pituitary adenoma.
Okay, so that's
Okay. Hold on. That is secreting TSH.
yeah, yeah,
Okay.
yeah. Could we just do 1 hour for today? Like I got something, and then we continue tomorrow.
Okay.
Yeah, yeah. So let's finish. Like we got 30 more minutes, and then okay.
Tomorrow will be during the day, right? Remember? Because
Yeah, yeah.
I'm working
I'm
tomorrow
gonna.
night.
What time? So what is the maximum? When do you start working?
I have to.
Okay. So what is the most common side effect of radioiodine therapy?
Most common side effect of radioiodine therapy, it would be like what do you call it? Um, like affecting the whole thyroid, hypothyroidism.
Good job.
Mm-hmm.
Mexican male with a weight loss, cough, abdominal pain, hypotension. CT shows calcification of both adrenal gland. So what's
Calcification,
so what's causing this adrenal insufficiency?
TB.
Good job.
Hmm.
MRI of a
Mm-hmm.
56-year-old man
Mm-hmm.
shows 1.5 cm pituitary prolactinoma.
Mm-hmm.
Okay, so what do you expect will happen to the TSH level and the prolactin?
TSH and the prolactin.
Mm,
So this patient, I say this patient, so this man has a, let's say, prolactinoma.
mm.
So the prolactin will be elevated. So if the prolactin is elevated, um, TSH is gonna be high.
TSH gonna be normal, and the
Is it normal?
prolactin will be around 200.
Why would the TSH be normal?
Yeah, that's a good question. So why do you think it's gonna be abnormal?
Because prolactin affects the TRH, right? The TRH is gonna be elevated. There's one weird connection, I don't remember, something like that. So thyroid releasing hormone, which is going to affect thyroid releasing hormone is in the not the pituitary, in the what do you call it? Um, what is before the pituitary? Um, oh, there is a connection somewhere right there. It's on first aid. I don't remember clearly. You know, it's physiology. I'm very rusty with my physiology right now.
Yeah, so TSH could be normal or it could be low, so won't get affected much, but the LH will be affected.
Which one?
The LH will be low, but the TSH will
Mm,
be normal.
okay.
Okay, it
I
doesn't,
need to, I need to look it up. Okay.
yeah, it doesn't affect the physiology most likely, because this is just prolactinoma, plaque
Mm-hmm.
ductal adenoma. Doesn't. Okay. Now, if you are a 30-year-old Hispanic male with
Mm-hmm.
insulin of 15, serum insulin.
Insulin.
Yeah, serum insulin is 15, is very high.
Okay.
And C-peptide is 0.8. So
Is it
normal is 0.2.
normal is 0.2 and the C peptide is 0. So C peptide is high too. Okay.
Yeah, what's your diagnosis?
Insulinoma,
Good job.
or it can be this sulfonylurea. Both of them are gonna have high insulin and high C peptide. So they say that the way to differentiate them is to do the secretagogue level. Yeah, I saw that somewhere. You
Yeah,
know how the exogenous one will be high insulin and low C-peptide?
yeah, you're right.
Secret. Yeah. Sulfonylurea is also going to be high insulin and high C-peptide.
Good job.
Oh, man. You can give me easy ones too.
Huh? Yeah.
I say you can give me easy ones too.
Yeah, like some of these, and I'm trying not to give them too much because you know that, but I'll give you
It's
more.
okay. It's
Yeah,
learning.
yeah, yeah. I can give you more
It's,
easy ones.
it's learning.
Yeah, yeah. So if you are a 27-year-old woman
Mm-hmm.
with a calcium of 11.4,
Mm-hmm.
okay, when EKG shows short QT interval and increased PR interval,
Short QT. Mm-hmm.
yeah, your stool is positive for occult blood,
Oh, cord blood. Okay.
okay, and you have many ulcers in the belly and multiple kidney stones. So what's your diagnosis? What else would you expect?
Many ulcers. Okay. So I am thinking this is men one. So you have the parathyroidism primary. Then you have the Zollinger-Ellison syndrome. So the three P's that we talked about, right? So the next thing will be your pituitary tumor. So pituitary tumor can give you a lot of things, you know. It can be increase prolactin, it can be increase um, maybe TSH, increase any of those hormones that you see from the pituitary.
Yeah, pituitary adenoma can
Mm-hmm.
increase growth hormone, ACTH,
Mm-hmm.
prolactin. It could be non-hormone secreting.
Right. It can be FSH, it can be LH, growth hormone, yeah, all those.
Yeah, hyperparathyroid causes hypercalcemia and stoners.
Mm-hmm.
Now here where it gets interesting. Okay,
Okay.
if they have recurrent peptic ulcer, that's a gastrinoma.
Mm-hmm.
If they have hypoglycemia, that's an insulinoma.
Mm-hmm.
If they have secretory diarrhea and hypochlorhydria, that's a vipoma.
Mm-hmm.
If they have necrolytic migratory erythema, that's a glucagonoma.
Glucanoma.
Yeah,
Mm-hmm.
so those are the pancreatic GI tract tumor.
That's good.
That's shit
That's a good one.
yeah, that's shit with men.
Mm-hmm.
Now, you're a 36-year-old woman
Mm-hmm.
presented with weight loss, heat intolerance, and physical exam shows 2 by 2 cm nodule in the left thyroid lobe. Radioactive scan shows uptake only in the nodule. So what's your diagnosis? What's the complication?
If the uptake is only in the nodule, that means a toxic adenoma.
What are the complications of this toxic adenoma?
So I think one of them would be like bone loss, right?
Smart,
Osteoporosis.
smart,
Yeah,
smart.
that's. I know that because I know I have a friend that has a hyperthyroidism.
Oh, that's tough.
Yeah, and the doctor is trying to decrease her levothyroxine, due to bone loss. Yeah.
Stuff, yeah. Increased fracture risk and stuff.
Mm-hmm.
So if you are a 48-year-old man
Mm-hmm.
with generalized bone pain that started 4 months after undergoing small bowel resection for Crohn's disease,
Small bowel reception. Okay, Crohn's disease. Okay.
yeah. So what do you expect? So you had femoral neck shows pseudo fracture bilaterally.
Femoral neck.
Yeah, shows pseudo fracture bilaterally.
Okay. Okay.
So what is consistent? What labs? So what
Mm-hmm.
do you expect will happen to phosphate, calcium, parathyroid hormone?
Again, tell me again.
Hmm?
Which ones are you looking for?
Yeah, so this pseudo fracture bilaterally, what's gonna happen? What are the values of calcium,
Mm-hmm.
phosphate, and parathyroid hormone?
Okay. All right. So if you have vitamin D deficiency, of course, you're not going to reabsorb calcium. Calcium will be low, phosphate will be low, and parathyroid will be high. So vitamin D deficiency will cause, because it's not there, you're not able to reabsorb the calcium and the phosphate in the small intestine. So those two will be low. Yeah, and
Yeah.
then the negative feedback, the PTH will be high.
Yeah, good job. Yeah.
Okay.
Calcium, phosphate low, PTH high.
Mm-hmm.
Now, if you're a 35-year-old male with
Mm-hmm.
poor exercise tolerance and
Or exercise. Mm-hmm.
and your potassium is 2.4 and sodium is 146.
Mm-hmm.
So, what's your diagnosis here?
I'm thinking it might be also Cohn's syndrome.
Smart, yeah, Cohn syndrome. You will have high serum bicarbonate, high aldosterone, and low renin. Okay, and now, if you're a 45-year-old male with
Mm-hmm.
coarse facial features and prominent frontal bone, and Joe, what you're most likely gonna die from?
Cardio issues
Yeah, congestive,
like CHF
yeah,
and
congestive heart failure.
cardiomyopathy.
Yeah, you're right, yeah. So if you are a 65-year-old man with acute MI and
Acute MI, okay.
complicated by cardiogenic shock,
Cardiogenic shock, okay.
when I check your labs, I found the T4 is 1.3 normal, T3 is lower like 70, normal is 80 to 180.
T3 is low.
Yeah, and TSH is normal. So
Mm-hmm.
what's your diagnosis?
Um, T3 is low. I'm thinking, what do you call it? Oh my, is something sick. It's not sick sinus syndrome. Sick sinus syndrome is in cardio. There's something you call it, like patients that are in the hospital and they have abnormal thyroid panel. What do you call it again? What is that name? Something sick, whatever. So help me here, Dr. Ali.
Close. Euthyroid 6 syndrome.
Yes, Pituitary syndrome. Yeah. I know if it's in the multiple choice, I'll find it.
Smart. Yeah, I know you will. So if someone present with coarse facial features, what
Hmm.
test do you order?
So I remember they said you have to do the screening. So you do the is it the IGF
Okay,
1?
okay, insulin growth
And
factor 1. What if that increased? What do you do after that?
then you do the glucose testing for confirmation.
Yeah, you do the glucose
If
suppression test, okay?
right.
There is inadequate suppression for the growth hormone.
Hmm.
What do you order now?
So that means it's abnormal, and then you now order I think CT. No, it's not CT. I take it back. So growth hormone, you order MRI.
Yeah.
You order
What
MRI.
if you found normal pituitary?
If it's normal,
Yeah.
um, I don't know.
You
What else do you do?
evaluate for extra pituitary causes of acromegaly,
Oh, really?
atopic growth hormone, GHRH secreting tumor.
So how do you evaluate for that?
Yeah, like you do CT of the whole body, see if there's tumor
Oh, okay. Sure. Okay.
somewhere or something.
Okay. Let me get another paper.
if you are a 27-year-old woman who present with hair on your cheeks,
27-year-old woman. Okay, hair on cheeks.
yeah, and left adrenal mass,
Left adrenal mass.
yeah, what test should I order right now?
So I am thinking Cushing's. So do you order the 24-hour urine-free cortisol or something like that?
You do dihydro, AP,
Oh,
androsterone.
DHES. Okay. The DHES.
Yeah,
EAS.
DHEAS.
Mm-hmm.
This one you find an increase in androgen secreting,
Mm.
producing adrenal tumor. So, what if you are a 36-year-old woman
Mm-hmm.
with a calcium of 7.8 and
Mm-hmm.
parathyroid hormone level of 110?
What is that? Is it low?
Mm,
Mm?
it's high.
Oh, it's high.
So, high parathyroid hormone but low calcium.
Mm-hmm.
So, what should I order next?
Hmm. So, what are the things that will cause? Hmm. I'm trying to see what is going on with this one. Is a woman, low calcium, high PTH. I can't really tell. Is this due to thyroidectomy or maybe autoimmune disease or something? No, I don't know.
So, whenever you have someone with hypocalcemia, first thing you do, you repeat the
It's
measure.
repeat.
Repeat.
Mm-hmm.
After repeating, still, then you ask yourself three questions.
Mm-hmm.
Is there any low magnesium? Is
Mm.
it due to drug? Second thing. Third thing, is there any recent blood transfusion? Okay. If any of these yes, then you correct that. If none of these yes, then you measure PTH.
Mm-hmm.
If the PTH is high, like this patient,
Mm-hmm.
then you have three causes, either endocrine, inflammatory,
Mm-hmm.
or oncology.
Mm-hmm.
Endocrine, for example, vitamin D deficiency and chronic kidney disease can cause hypocalcemia with high PTH. An inflammatory, like pancreatitis, sepsis, can cause that, and tumor lysis also can cause that. Okay.
Okay.
So what if you have hypocalcemia with normal or decreased PTH? So what causing that?
Hypocalcemia.
Yeah.
Oh, okay. Yeah, I think this one I'll remember. It can be surgical. It can be due to taking out the taking out the parathyroid, or due to surgery in the neck. It can also be maybe like a infiltrative disease like a hemochromatosis and Wilson disease. It can also be maybe due to autoimmune disease. Any of those things that will like affect the parathyroid gland.
Yeah, good job, yeah. Now, if you have the ionized, so this, I want you to explain what is the relationship between acid, base shift, and calcium homeostasis? So in case of acidosis, what's gonna happen to the ionized calcium?
Mm,
It's gonna increase or
okay.
decrease?
I remember it's gonna be for okay if you have high calcium, right?
If you
Is that
have
what you asked?
acidosis,
Mm-hmm.
what's gonna happen to the ionized calcium? Is it gonna be high or low?
It's gonna be high.
How about alkalosis?
It's gonna be low.
Why?
In something in your world like you have the what do you call it? There's this structure they showed in your world where you have the albumin, right? Albumin and something I think
Good
like
job, good job.
acid, yeah,
You know
hydrochloric,
it, yeah, you know.
yeah,
Good job. Yeah, because the H will sit at the place of potassium. So if there's high H,
right.
potassium doesn't sit. If there's no calcium,
Calcium.
yeah, calcium will sit, yeah.
And then you release it into the blood. So if acidic, the ionized calcium will be high.
Yeah, that sounds good, yeah, so that's good. Now, do you think could we
Stop.
let's do a rapid review for what we did, and then we continue tomorrow, yeah.
You sound tired.
Yeah, I don't know what happened to me, like,
Are you studying for step 3?
yeah,
Or are you teaching other classes?
yeah, I teach other classes, like for step 3 too. Yeah, for step 2 and step 3, doing both, yeah. Doing CCS, yeah. Sometimes I push myself too much, I should give some break. Yeah, so now we discussed about pheochromocytoma, we talked about subclinical hypothyroidism, concentropin stimulation test, contraindication of migraine, and GLP-1 decreases weight. We talked about the renal failure and parathyroid hormone. Talked about vomiting, as like vomiting alkalosis. We talked about resistance to thyroid. We discussed HHS and the calcium homeostasis and the DKA. Talked about the management of Graves. Talked about Leiding tumor, MEN 1, MEN 2. We discussed glucagonoma. We talked about the Cone syndrome, hypercalcemia, and hypocalcemia. We talked about Cushing, and we talked about the side effect of radioiodine. We talked about TB, adrenal insufficiency. We talked about prolactinoma treatment. We talked about beta insulinoma. We talked about MEN 1, 2, 3. Talked about osteomalacia. How do you diagnose it? By increased alkaline phosphatase, increased parathyroid hormone, increased calcium, phosphate, decreased urinary calcium, decreased 25 hydroxy vitamin D. X-ray shows thinning of cortex with reduced bone density, and bilateral symmetric pseudofracture are characteristic radiology finding. That's it. Fingerstic glucose, and we discussed gigantism workup. We discussed dihydroepiandrosterone, like adrenal androgen secreting adrenal tumor, and we talked about hypocalcemia and the acidosis alkalosis relation to ionized calcium, and that is it. So that's a summary for today. First part of endocrine. Continue the second part tomorrow then.